and you can find me going forward starting Monday. You can find me on here on HAPS 3 days a week at 9 p.m. So if you were on Periscope, join HAPS. You can now find me here on a regular basis. And how is everyone doing tonight? So I'm broadcasting to you tonight via HAPS and on Facebook as well as YouTube and some other social media channels, about maybe 3 or 4 of my different groups on Facebook as well as YouTube. So, what we're talking about tonight is it's okay to ask your doctor questions. I spoke with a friend tonight, and we were just talking about some health related matters. And she confessed to me that she had been, carrying around some guilt for a long time. And the guilt stems from her son has a chronic illness, and as a result of the chronic illness, she just felt so bad as a mom because she never asked the doctor questions. Part of her not asking questions is because her son is an adult, and by him being an adult, I mean, it's not like she could go into the exam room with him. It's not like she can pick up the phone and call the doctor because this is all HIPAA related, right? So they're not going to have that conversation with her. And part of the reason why she's been carrying around a lot of guilt is because she said, Nisi, I feel ashamed because my son has been dealing with this health problem for a while. I never thought to ask the doctor questions. She says, my son did not want to share with me what was happening to him. And again, I just feel that I let him down. And so I listened to her explain to me this entire situation. And what I shared with her was, don't feel guilty, because here's the thing. Some people feel that their doctor walks on water. They do not. Some people feel that it's never okay to ask a doctor questions. That's not true. You have a right as a patient to engage with your doctor. You have a right as a patient to have a caring healthcare team that's in place, that's there for you. I cannot imagine, you know, having a doctor who is not engaging, who's not communicating with me. Yes, I have experienced that, and they're no longer on my team. My philosophy is this is Team Nisi. And if you, as a healthcare provider, are going to be on my team, it has to be a collaborative working relationship, basically a partnership. That means when I present to your office and I have some health issues or concern, dear doctor, I do expect you to communicate back to me. I do expect you to listen to me, um, especially since I'm the type of patient that's compliant. I get sometimes that some doctors may have patients that no matter what they say or do or recommend to them to help them with their medical care and treatment, the patient won't comply. And sure, some doctors don't like that. But with me, if I'm going through the trouble of paying you for my medical care and treatment, you better believe I expect a relationship with you, a partnership. I also expect you to communicate with my other healthcare providers that's on my team. And so what I shared with my friend was that, it's different for men versus women. When you are a man, and I'm not speaking for all men, but men that I know, when they go to the doctor, they may not ask the doctor questions. They may not tell you about the doctor's visit or how they're feeling or what's going on with them or what's bothering them. Whereas we as women, we chat with one another. We talk with our girlfriends. We talk with our friends. We let them know, hey girl, I'm dealing with this situation. I went to the doctor. These are my symptoms. This is what they said. Blah blah. And we talk about what's going on with us. I just think that that's just how we relate to one another. Whereas men is totally different. I know that with the men in my support group, for example, who have fibromyalgia, They are not very vocal in the support group with us women, but they will reach out to me privately to say, hey, Nisi, this is what I'm dealing with. Can you help me? That type of thing. And the reason for that is because with many men, they may be the breadwinners in their family. Even if they're not the breadwinners in their family, health related matters may not be something that they're comfortable sharing with their family because number one, they may not want to worry them. Two, they may be stressed out themselves. And two, the man in question may feel that, you know what, I need to be strong for my family. I don't want them to see that I'm afraid or that I'm worried and I'm stressed. They feel that they have to protect everyone. But here's the thing, it's okay to talk, it's okay to share with other people how you're feeling. It's actually okay to have a conversation with your doctor. I'm blessed in that I have a great team of doctors that I can talk to about things that are bothering me. Um, I trust them. I feel it's a safe space where I can just open up to them about what's going on with me. I may not tell everyone in my family what's going on with me, but I do have that conversation with my doctors. Why? Because, again, this goes back to building a relationship where, they've been on my healthcare team for a number of years. They know me. And so it's, that give and take where I can talk to them, I can share with them. That's vitally important because if your doctor doesn't really know what's going on with you, then they cannot support you always in the manner in which you need to be supported. And I'm going to give you an example of that. Let's say you're someone dealing with depression and you know it. Your family's noticed that there's something off with you or something wrong, that you maybe have not quite been yourself, but you don't even want to talk about it with them. You know, your doctor, if you discuss it with them, they can get you some help. That help can be in the form of counseling. It doesn't always have to be med. Sometimes talk therapy can do wonders. So that's why it's important to be able to have a trusting relationship with your healthcare provider. So my friend that I'm telling you all about, she has just been carrying around all this weight because she shared with me that her son's illness has been, ongoing for a while. And she just felt that, hey, maybe I should have been involved more. Maybe I should have asked more questions. Maybe I should have demanded more information. And I shared with her that, hey, he's an adult. Your son um, does not have to tell you what's going on with him. Don't be so hard on yourself. Don't beat yourself up. When your child is ready to have that talk with you, maybe he will, maybe he won't. But what's important for you to do is to hold that space for him so that he knows it's okay to talk to mom. Because sometimes, he may not want to worry her. And that's what I was sharing with her. And she did share with me that she felt that could have been it possibly as well because he would just simply tell her, okay, it's going to be okay. I don't want you to worry about it, that type of thing. So he's concerned about his mom. He's also concerned about himself. So those of you that are here with me live tonight, have you ever experienced that? Have you, ever experienced people, you having a situation where you're dealing with something and that the doctor said, and you didn't tell anybody? And if so, would you mind sharing with me tonight why that may have been? If you want to join me live on tonight's broadcast, let me know. Put it in the chat. I will be happy to bring you on in. But it's important to have that conversation with your doctor about what is bothering you. I have found for me that I've gotten the most success, the best of care, when I've been able to talk to my doctors about how I'm feeling, what I'm dealing with. I remember one time I was dealing with a bullying situation at work, and I just wasn't myself because I was stressed about it. I tried to resolve it on my own to no avail. And, my doctor sensed that something was deeply bothering me. And one day when I went to the office for a follow up, he said to me, I can feel that there's something that's really bothering you. He says, yes, I know I have another patient right after you. He says, but this is your time, Nisi. Let's just talk. Tell me, what's going on. Maybe I can help. And he was able to get me some help to deal with the situation. That's why I'm saying that it's vitally important that you be able to communicate with your physician, to be able to communicate, to talk about what is bothering you. Because if I have a doctor that I can't talk to, or if I have one that has a poor bedside manner, or one that lets me know that they don't want to be bothered with me, guess what's going to happen? I'm not going to see them again. Now, I do have some friends who have said when that happens to them, they just shut down and they just don't challenge the doctor. They just don't say anything. I'm sorry, I'm not built from that cloth. I just feel that I'm the patient. So if I'm the patient, I'm the one in the driver's seat. I'm the one that's deciding who's going to be on my healthcare team. And if you cannot play nice with others, you can't be on my team. Because, see, when you have a chronic illness, you need people on your team that are there for you. You need the type of healthcare providers on your team that will communicate with other healthcare providers that you are treating with so that everybody's in the loop concerning what's going on with you. This is vital because let's say one doctor prescribes one type of medication and you're seeing somebody else who's not talking to the other doctor. They don't even know about one another because you haven't shared that. And then they prescribe you some medication. And then that medicine interacts negatively with the other medication. And let's say you're someone who's getting your scripts refilled, at multiple different pharmacies. That's why it's important to communicate with your doctors because they need to know what's going on with you. And what I do is when I have a doctor's appointment, kind of like I did a couple of weeks ago, when they prescribed some new medication for me, I said to my doctor, okay, hey, before I start this, did you reach out to, my other doctor, are they aware that I'm on this? And he said, hey, no worries. I've already texted her, so she's aware that I prescribed this and that you're going to be starting this. That made me feel really good to know that they communicate with one another. Because again, that's teamwork. That's being a member of my team. Because I know too many people who have physicians that's been prescribing them all these different medication, all these different opioids, and nobody's talking and listening to anyone. And it's just had some really bad side effects. That's why it's important to talk. Because again, you are the patient. I want everyone to take an active role in their healthcare, not passive, active. So when I say active, that means when you go see your physician, I want you to go to your medical appointments prepared to have this dialogue, this conversation. So what I mean by that is I have for here, I have a notepad. So before my appointment, I have already outlined what my expectations are for that visit and the outcomes that I'm looking to achieve from that visit. So maybe for my visit, I'm looking to find out from my doctor, okay, what are my test results? What does this mean? I may also be looking to find out from my doctor what is ongoing research for my condition. You know, what are you aware of that I don't currently know? Is there any new research out there? If I was recently, for example, given a new diagnosis, then what I'm looking to achieve from that appointment is number one, what is my prognosis? Where do we go from here? What is my treatment plan? Okay. What are you recommending for me and why? How frequently will I need to visit you? Okay. Are there any specialized tests that I need? I may also be asking, what is your experience in dealing with this type of condition? Because I don't want someone experimenting on me who's never seen a patient like me, depending upon, or you, let's say you have a particular type of condition, and maybe your doctor has only seen maybe only two other patients with something similar. So they have not had a whole lot of experience with it, right? You want someone who's board certified in that field, who has the specialized training that can treat you properly and make proper recommendations. So all that really matters. So that's why it's important to ask questions, especially when it comes down to medication. Some of the questions that I'll ask about that is number one, are you recommending that I get brand or generic? It matters because of cost, but not only because of cost, because sometimes some generics that I have received don't work as well as brands. I've had it where sometimes the generic did work better than the brand, or vice versa. The other reason why I'm going to ask questions about that medication is because since I'm someone who has a lot of sensitivities and allergies, I need to know what are the potential side effects. I ask those questions just so that I can be prepared. So that's why it's important, as I mentioned, to be able to be prepared for that visit. So when you're prepared for that visit and you go there to ask questions, that's crucial for you, because the one thing, I don't know about you all, but what I don't like is I don't want to go home saying, "Oh darn it, you know what? Why didn't I ask any questions?" That never happens for me, because generally when I go, I always have a whole lot of questions to ask, and they're used to me asking questions because I want to know. So years ago, when I worked in medical education, I attended this event with a lot of other docs, and we were having dinner. And one of the doctors mentioned at my table that when a patient presents themselves to his office and they don't ask questions, he doesn't waste time talking to them, because he feels that if they're not vested in their health care, why should he be? And that really angered me, because when people don't ask questions, it's not because they don't care. People, a lot of times, frequently, don't ask questions because number one, they don't know what to ask you. They may still be trying to process everything that's happening to them, what's going on with them. Let's say that you're someone who received a diagnosis of cancer, any condition, and you're just, you're hearing what they're saying, but then you're not really hearing, but in your mind, the wheels are turning, and you're feeling a little bit stressed because, they just shared this news with you about your diagnoses, and your mind is just racing, right? It's not because you don't care. Number one, you could be shell shocked. Number two, you're stressed to find out that there's something wrong with you and you're worried. It's not because you don't care. You do care. You want to know what's going on with you. And a lot of times people feel they make wrong assumptions that because if you don't ask questions, you don't care. That's not what that means at all. You just don't know what questions to ask. So, as a patient navigator, that's one of the things that I do very well. I help patients prepare for their visits, take them by the hand to give them support. Because, it's a scary feeling when maybe you're all alone. Maybe you're in a state, maybe you relocated somewhere where you don't have any family or friends. And you go see a doctor because you start notice that there's some changes in your body and you don't know what's going on. And you get a diagnosis and you're so stressed and you have no one to turn to. You need help, you need support. I know that's how I felt initially when I was first diagnosed with fibromyalgia. I had heard the term fibromyalgia, but I didn't know anyone that looked like me with fibromyalgia. And it took a lot to get that diagnosis, because they would always say to me, some of the doctors, and I'm no longer seeing some of these doctors, thank God for that. But I had some who would tell me, women of color don't get fibromyalgia because you all handle pain well. That's a bunch of crap. Um, so I had to find the right doctor for me that can help me with this. But ask questions. I cannot stress that enough. Ask questions. If you have a doctor that doesn't want to answer your question, let that be a red flag. Ask questions. That's so vital. It makes all the difference in the world. Ask questions. It's just like for example, let's say, women, we're in the shower or the bath, and you do your own self breast exams, and you start feeling that you have a lump somewhere. You go to your doctor. You don't just show up and say, okay, hey, I touched something, and don't ask any other questions. Ask questions. You need to know, is it hormonal? Is it a lump? Do I need a biopsy? Do I need an ultrasound? Ask questions. Ask questions. I'm stressing that because for a lot of people of color, we deal with healthcare disparities where we don't always receive the best care from our doctors. It has nothing to do with not having an insurance. Whether you have insurance or not, there still should be the expectation, if you are a healthcare provider, that you are providing quality care. For many people of color, some doctors, not all, because I do have a wonderful healthcare team. So I'm not speaking of my healthcare team. I'm just speaking of overall and what I have experienced in the past when I did not have a good healthcare team, where they didn't they were not forthcoming with information. They did not provide to me the same care that they would provide to someone that may have been Caucasian. When it came down to being a woman of color, they made value judgments decisions to determine that I wasn't worthy. So that's why I'm a big proponent of asking questions. Just like when you go to a doctor, they're checking you out as a patient, you've got to check them out. Check out their reviews. Okay, watch those reviews, read up on them, find out if they're board certified, find out what their experience is. If they don't treat you well, then you know what? Find somebody else. Sometimes you may have to get a second opinion. Sometimes, in addition to the second opinion, you may have to get a third opinion, fourth opinion, fifth opinion, and so on and so on. And I've done that because you know how sometimes you go to a doctor, you may get some information and you may feel that, something just doesn't seem quite right. Or you just feel in your spirit that, mm, no, something what they're telling me is not quite right. Let me go see someone else. I mean, I've done that where I have had multiple opinions from a doctor. When I say get a second opinion, do not get a second opinion from someone who's in that same practice with your doctor. You want an independent physician, independent of that practice, because you know what happens when you're seeing someone in the same practice as the one who gave you the first opinion? They tend to concur with one another. They don't tend to want to um, tell you anything different, even though they may know that the person who told you something the first time didn't really tell you everything. Make certain that it's independent of that medical group, because you do want an independent opinion. I don't want somebody to just look at what Dr. Jones, just making up a name, says and says, okay, well, they said this, so it must be okay. No, 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 no. You do not want that. You want an independent medical opinion. That is crucial. Now, I don't know if I've shared this with you all, but years ago, when my dad had lung cancer and he's now deceased, it all started with him having a sore throat. And after 30 days, the sore throat had gotten worse. And I had told my dad, I says, Dad, something's not right here. I know this doctor keeps saying that it is just a sore throat. It's more than just a sore throat. Do you know that when we got a second opinion, it wasn't bronchitis that my dad had? He had lung cancer. The cancer had metastasized to his lungs, then it metastasized to his brain. He also lost sight in his right eye. We had wasted those 30 days were crucial because they had given my dad only 3 months to live. Due to the grace of God, my dad lived for 3 years after his lung cancer diagnosis when they had given him 3 months to live. So think about it. For 30 days, this doctor kept telling my dad, all you got is just bronchitis. It wasn't bronchitis. He had lung cancer. And I'm still angry about that today because I really feel that time was stolen from my family with my dad. Had he been properly diagnosed, I feel that he could have lived longer. But again, due to the grace of God, I am thankful that instead of him, you know, living for just 3 months, that he lasted for 3 years. But still, it just angered me that, again, a doctor made a value decision, didn't think that my dad's health mattered, and just simply said, oh, it's just bronchitis, go on your merry way. Even when he would go back to this doctor again, oh, it's just bronchitis, he never did any tests. And then to find out that my dad has lung cancer, that's not right. I don't care if you have an issue with people of color. I don't care what your issue is. Bottom line is, if you are a healthcare provider, you shouldn't be seeing color. I have all kinds of doctors. I don't see color in my doctors. What I'm looking for is, what matters to me is not the color of your skin. What matters to me is, do you know what you're talking about? Are you educated enough? Are you trained? Do you know what you're doing? Is this within your scope? Is this your expertise? Are you board certified? Have you seen patients like me? Have you experienced this before in your practice? Okay. I'm not looking at your color of your skin saying, because this is your ethnicity, you don't know anything. No, no, no. That's not what I'm focused on. I want help. So I'm focused on you. Do you know what you're doing? Have you had experience treating this condition? So it should never come down to one's race in terms of if you're going to get good care or poor care. It should never come down to that. Never, ever. And if a healthcare provider is making those types of value judgment decisions, then you know what? As far as I'm concerned, their license should be stripped from them because that is absolutely not right. And that is what happened to my dad. And it really hurts my heart. That's how I got into being a patient navigator in advocacy, because this is something that I am really, really passionate about, because I know what my family endured watching my dad die, dealing with chemotherapy, dealing with radiation therapy. Think about this. My dad was close to 6 feet inches tall. He weighed more than 250 pounds. And when he died, he weighed 69 pounds, folks. 69 pounds from over 250 pounds. The cancer just ravaged his body. And again, had he received proper medical care and treatment, proper diagnoses, he could have lived a longer life, but he didn't. So, unfortunately, that's what happened to my family. And ever since then, I've been on this mission that when it comes down to patient advocacy, being a patient navigator, getting the word out to people that, hey, this is serious business. Ask questions. If you're not comfortable asking your doctors questions, bring a notepad with you or bring someone with you to that visit that can be there by your side if that's going to make you feel more comfortable. Even if it means saying, hey, doctor, okay, if you don't mind, I need to take this just so that I'll have something to listen to later. Okay, it's important. Do not leave that visit without asking questions. And I'm going to say it again, don't leave that visit without asking questions, because if you don't ask questions, that could be another situation like my dad who died of lung cancer. See, when my dad first went to the doctor and they said it was bronchitis, I wasn't with my dad then, because, he went, he thought it was bronchitis. But you better believe when this went on for like 30 days, I said, Dad, we're going with you to the doctor, because I just knew, I just knew it. I just knew it. I just felt it in my gut. I just felt it in my spirit that no, this is not bronchitis. And we got an appointment to see a specialist, and I went with him, and that's what it was. It was lung cancer. So that's why I'm so passionate about the work that I do, helping patients, because I'm going to tell you, the worst thing is to find out and to hear a doctor say, hey, had you come to see me sooner, I could have helped you. In my dad's case, we couldn't go any sooner than when we did, because the one doctor was saying it was just bronchitis, and my dad believed it. But 30 days later, we did get a second opinion. If you have family members out there, now is the time to be asking questions. Look out for your loved ones, especially with COVID. Ask questions. A lot of times people don't want to ask questions because they feel that, oh, I don't want to be construed as someone who's being intrusive. It's not a matter of being, intrusive. It's a matter of caring enough about your loved one to make certain that they are receiving proper medical care and treatment. Also, we're dealing with cultural competency because, when it comes down to different types of medical terminology, the doctor may say one word, you may not know what that definition is. So I give an example. So when it comes to diabetes, some people may not refer to it as diabetes. Some people may say sugar, just using that as a number. Just using that as a name. Again, cultural competency, recognizing that culturally, you know, in different communities, certain conditions, we refer to them in different names, having that conversation with your patient to educate them and to find out what do they know about the condition that they've been diagnosed with. You as a caregiver or as a patient, please do your due diligence to get your questions answered. Do your due diligence to help your relative or loved one or friend get their questions answered. Please do that. Ask questions. And as I shared with my friend today, who has felt a lot of guilt because she didn't ask questions when it comes down to her son's health, I shared with her, release yourself of that guilt. You did the best you could with what you knew, but going forward, now that you know better, do better. Ask questions. Ask questions. If you go to a doctor and they're rushing you and they won't let you ask questions, then you know what? Kick them to the curb. Um, I'm gonna share with you all a situation that I dealt with. I had been seeing this one doctor for probably 6 or 7 years, and the one time I went to go see her, she came into the exam room. She said, "Okay, Nisi, I'll be right back. I left something on my desk." I says, "Okay." Guess what, y'all? She never came back. She literally went into the patient in the room next door to where I was, because I can hear her talking to the other patient. She never even came back to where I was. So I'm sitting there and I open up the door and I say to the nurse, "Excuse me, um, she says she left something on her desk." She never came back. The nurse said, "Oh, I don't know what happened." You may not have known what happened. The least the nurse could have done was to go knock on that door or say something to the doctor to let that doctor know that she forgot that I was in the room that she didn't come back to. Well, I got rid of her. I wrote her a little letter letting her know that since she could not remember long enough from a minute that she neglected to follow back up with me or come back into the exam room, that I was letting her go. That I thought it was best that I move on to another physician because I was just not going to tolerate that behavior. Also, I had already paid my copay for that visit, and then you don't bother to even show yourself. And the other thing I did was I notified my insurance carrier to request the money back for the bill, because why should you be paid when you showed up for barely just 1 to 2 minutes, said you be right back, and you never showed up? But I've already paid you a copay, and then you go see another patient, but you never come back to see about me. No, you don't deserve to be paid. What are you being paid for? No, it's like a no-show. What are you being paid for? So I did request that money back. So I'm the type of person that I take an active role in my healthcare. I am not passive. And I want the best care for me. I want the right people on my healthcare team, people who care about me as a patient, who value me as a patient. And if you have healthcare providers who don't value you as a patient, start looking. I get that, depending upon the type of insurance you have and the type of plan you have, you may have limited options, but do the best you can with what you got. Still take an active role, still be looking for other physicians, research them. Okay? Research them. So if you have enjoyed tonight's broadcast, at the top of the screen, it tells you how to follow me and subscribe to my channel here on HAPS TV. And if you're new to HAPS TV, when you join, you get coins for joining. Okay. So thank you so much for tuning in tonight. And happy Easter and be blessed, everyone. Thank you so much for tuning in tonight. And I will see you all on Monday. Be blessed. And again, remember, it is okay to ask your doctors questions about your health care. Take an active role in your health care. Don't be passive. Be active. It's okay.